So again, this is Curbside Consult. This is Harold Pollack, and I'm talking with Aaron Carroll. Uh, how do you think healthcare reform, aside from the website, how do you think it's going so far?
God, it's so, it's one of those where it doesn't happen until January 1. We keep putting this off, but the things that have happened so far are real for the people that they affect, but on the smaller scale, I don't think people are realizing them. And even now, as everybody freaked out about October 1st, 2013 is the day it really kicks in. Well, that's when people can finally start signing up for benefits that still don't kick in until January 1. So no one gets their Medicaid until January 1. No one gets their exchange private insurance until January 1. That's the day when this finally happens, and that's when it will be hard to take away. I think that's when people will finally start seeing benefits. And even then, they won't see it immediately. It'll not until they sort of access healthcare. But it's not going to really happen, for still another couple months now. And so it is frustrating for those of us who keep waiting to see what will happen and to finally be able to talk about that. But I still don't feel like it's actually going yet.
I think you're right. By the way, I think when people see this, and this gets back in a way to the media narrative we were talking about, I think there'll be a cycle of stories about the comeback of Obamacare. And one of the things that will drive this, first of all, the website will be less of a humiliating mess than it is right now. If that doesn't happen, we're all we're all in trouble. I think that it's already better than it was, and also people will see that hey, what's offered is actually good. And in fact, it's cheaper than people predicted 3 years ago. And there'll be just more people saying, "Hey, this is actually not bad." And the media will just be having been bored with their previous narrative. This will become the new narrative. And places like Kentucky that are working well, people will say, "Hey, this is actually really transforming the landscape, and all these uninsured people are getting some benefit."
And I have enough sort of awareness to know now that then I'll probably be happier with the media, or at least less displeased, and people on the right will start talking about how it's the liberal media and all they do is cover the good parts of Obama. I mean, granted, we all sort of have sour grapes when it's not going in the direction that we want,
Absolutely.
but I do agree that at some point it will shift. I think when people do see benefits, the problem is, what benefits would you see right now? It's that the website worked and you were able to buy something which you can't even have yet. That's just not a story. And so there's nothing to cover. I mean, somebody actually saying, "Yay, I'll have Medicaid in 3 months," is not exciting.
It's exciting to those of us who are health policy wonks.
Yes,
could be more
but it will not. It won't make for meaningful television, or especially in a 24-hour news cycle, a compelling story. Somebody who goes like, "My bill tripled today," or I got kicked off my plan today is meaningful. It's relatable, and so people will buy into that. I think that it's not until actually next year when it's the, "Hey, you know what? I have had diabetes forever and never been able to get care, but now I can." That's a story that's something people can relate to. So that may shift the narrative at that point.
By the way, I think one of the good things about that, and actually I think one of the good things about what's happened in the past month compared to the past several years is at least it's a narrative about things that are real.
Yeah.
And, the website is a real thing. Either it works or it doesn't work. Yeah. Health insurance is either going to help people or it's not going to help people. Either it's going to be affordable or it's not. And there's going to be lots of anecdotes and lots of things heading in all sorts of confusing directions, but at least it's not like death panels.
Well, I was going to say, at least I'm not hearing about slavery and the Nazis all rolled up into one and the end of days. It's now, hey, the website doesn't work, or somebody's bill has gone up 22%. At least it's a grounded, real fact that we can discuss in terms of pros or cons about whether it's the trade-offs and the benefits are worth it. But I think you're right. I think you're absolutely right.
Yeah, and again, this is Curbside Consult. This is Harold Pollack and Aaron Carroll. I will say there's one thing that makes me optimistic right now, which is I think we're starting to see the rudiments of bipartisan cooperation. And in the long run, I don't think health reform can work with Democrats imposing their will to do it themselves. And I think there's a couple reasons for that. One is it's not November 2008 anymore, or early 2009, and the country is not, to pass health reform, we needed this unique political moment where the Democrats had legislative dominance and could actually pass something this ambitious. And there was a moment when after President Obama's election, that moment has passed. And I think Democrats, especially in the wake of the troubled rollout, realize that, or should realize that. But it's also not November of 2010. And Republicans are also chastened because of the kamikaze effort to close down the government over Obamacare and to sort of try to use the debt ceiling. And I think now Republicans in Washington and Obama are not going to get along. But when you mentioned Arizona, when you see these Republican governors who really have actual responsibility for hundreds of thousands of people, and they have to talk to hospital executives, and they're real stakeholders, they want a dignified path to actually take the money and to help people and their constituencies. And President Obama wants a dignified path to work with them. And I think it's going to be hard for the core activists on both sides of this debate to make the kind of concessions that both sides are going to have to make. But that's really where, if this thing's going to have legitimacy, and if we're going to get state governments to not only take the money but to enthusiastically work to actually implement the thing well, there has to be a real coming together that is not, it's the president's central achievement and these other people being dragged into it.
I don't think you're wrong. I think part of it, though, is we've gotten away from just sort of what would be termed normal negotiations. It's sort of like, in a negotiation, it's this is what I would like, this is what I'm willing to give up. And both sides sort of have to figure that out and then say, okay, I get this, you get that. I get this, you get that. We have not had that kind of discussion for a long time. And it's been more along the lines of like, Democrats passed it because they could, and now Republicans sort of want it just to go away because it can. And when it has come down to sort of what they would even call negotiations, it's give us what we want and we'll keep the government open, as if that is a concession to Democrats. And it would be more along the lines of like, hey, if you want this done, then this is something that Democrats want. I mean, it's the same kind of thing where it's like, if you want spending cut, they want revenues raised. So if you want what you want, they want what they want, and try to find a way to balance the two. But if you immediately rule out everything that they want is not okay, compromise cannot be reached. So I agree that Democrats can't push this through themselves, but at some point, I think that many of the people on the far right have to learn to take yes for an answer. That they have to learn that it's like, okay, you can have some of what you want, but you also have to have some of what you don't. And you can't just have what you want.
Yeah, and in a way, it's restoring the propriety and the legitimacy of incremental politics and negotiation. And that's something that many people basically just reject.
And compromise. I mean, it's just that it's a sort of we need to relearn what the word compromise means. It's just, I think sometimes people are trying to change what the word actually defines. And that's a problem, because if we can't even agree on sort of what compromise means, it is therefore impossible to achieve compromise. And that's a real problem.
So hold on for just one moment, and we'll return to Curbside Consult.
Yeah.
I just want to thank everyone for joining us today, and for another issue of Curbside Consult. And it's great to have my friend Aaron here visiting me for the day. And I'm going to read to him aloud all the books behind me.
All right.
And thanks everybody for joining us.
Thank you.